Hello and welcome back to my channel. In this video, I'll be talking about peptic ulcer disease. The purpose of this video is to explain peptic ulcer disease in the simplest way possible. If you're a returning subscriber, welcome back to my channel. It's nice to have you here. If you're yet to subscribe, please do subscribe to my channel. There's a lot to learn here. Okay, so peptic ulcer disease. What is peptic ulcer disease? Peptic ulcer disease is a condition where the mucosal lining of the stomach or upper duodenum has been eroded by acid or pepsin, leading to injury. This is what a peptic ulcer looks like. When you hear the term peptic ulcer disease, it actually comprises of gastric ulcers and duodenal ulcers. So it's either the ulcer is located in the stomach or in the upper part of the duodenum. Now, there are two common forms of peptic ulcer disease. Those associated with H. pylori, that's Helicobacter pylori. That is a bacteria that infects the stomach, and those that are associated with NSAIDs and aspirin. NSAIDs, that's non-steroidal anti-inflammatory drugs. NSAIDs have three functions in the body: analgesic, anti-inflammatory, and antipyretic function. So they are commonly prescribed due to pains, inflammations, fever, and all of that. So they are commonly prescribed drugs. 95% or more of duodenal ulcers are associated with H. pylori, that is the bacteria that infects the stomach, and 80 to 85% of gastric ulcers are associated with NSAIDs. So it's safe to say, or it's correct to say, that most peptic ulcer diseases are caused by the presence of H. pylori in the stomach. One thing you need to note is that 90% of the population in this part of the country, like in developing countries, actually have this bacteria, Helicobacter pylori, but only 5 to 10% of infected persons will go on to develop peptic ulcer disease. And this is because some species of the H. pylori genus are more virulent than others. Other factors like age of infection, ulcer-prone hosts, like people that have a family history of ulcer, and also interaction with other ulcerogenic factors like concurrent use of NSAIDs can also play a role. So a person who is infected with the H. pylori bacteria and is also using NSAIDs is at more risk of getting the disease. The common clinical manifestation of peptic ulcer disease is upper abdominal pain that is usually relieved by food or use of antacids. So if you commonly have upper abdominal pain and the pain is usually relieved by food or by antacids, it could show that you have ulcer. A relationship to food is more marked in duodenal ulcers than in gastric ulcers. For example, about an hour to 3 hours after meal, you begin to feel the pain in cases of duodenal ulcers. So duodenal ulcers are more related to food. However, the symptoms of peptic ulcer disease lacks specificity. So it might not be easy to differentiate between gastric ulcer, duodenal ulcers, and even between peptic ulcer and other common or associated diseases like gastritis, dyspepsia, GERD, and other related diseases. Anorexia, weight loss, heartburn, nausea and vomiting, eructation can all occur in peptic ulcer disease. And these symptoms also show in some other diseases like dyspepsia and GERD. Patients with predominant symptoms of heartburn are more likely to be diagnosed with GERD and not necessarily ulcer. I'm going to be making another video where I'll be pointing out the differences between these related symptoms like ulcers and GERDs and heartburn and indigestion, all those related diseases. I'm going to be making another video where I'll be pointing out the differences. The most severe complication of peptic ulcer disease is stomach bleeding, and it is important to mention this so you can know that ulcers should be treated ulcers can be treated. A lot of people say ulcers cannot be treated, but no, it's not so. Ulcer can be treated. It's not okay to have symptoms of ulcer and just let it persist. The investigation for peptic ulcer disease include endoscopy, radiology, and H. pylori tests. The H. pylori tests include urea breath test and stool antigen tests. The breath test is more preferable and convenient. Now to the treatment of peptic ulcer disease. Like I mentioned earlier, there are two common forms of ulcer, the one caused by the H. pylori and the one caused by the frequent use of NSAIDs. So the logical way to treat the ulcer will be to eradicate the bacteria or to discontinue the non-steroidal anti-inflammatory drugs causing the ulcer. In a case of H. pylori eradication, antibiotics will need to be combined with acid suppressing agents. It is not enough to use acid suppressing agents alone, and it's not enough to use antibiotics alone. They both have to be used combined. Acid suppressing agents include drugs in the classes I'm about to mention. We have proton pump inhibitors like omeprazole, rabeprazole, esomeprazole. We have H2 receptor antagonists, for example, cimetidine, ranitidine. We have bismuth chelate, we have sulcrafettes, and we have antacids. Antacids can either be magnesium-based antacids or aluminum-based antacids. Calcium is usually not used because they aggravate ulcers. Antibiotics used for H. pylori eradication has to be a combination therapy. A triple therapy consists of either OCA or OCM. OCA being omeprazole 20 mg, clarithromycin 500 mg, and amoxicillin 1 gram. OCM is omeprazole 20 mg, clarithromycin 250 mg, and metronidazole 400 mg. So either of these regimens can be used. Both therapy act synergistically as growth of organism is enhanced at elevated pH and efficacy of antibiotics is enhanced during growth. Additionally, increasing intragastric pH may increase antibiotic absorption, so it is best used together. You would have a perfect therapy if the acid suppressing agent is used with the antibiotics instead of using one and leaving one. In cases of frequent or prolonged use of NSAIDs, this can be easily known or detected by interviewing the patient. The NSAID has to be discontinued and replaced with other analgesic options. Examples of NSAIDs include diclofenac, ibuprofen, naproxen, celecoxib, aspirin, and the likes. So these drugs would have to be discontinued and replaced with other analgesics that can be tolerated by ulcer patients. Like I said earlier, I'm going to be doing another video to point out common differences between ulcer, dyspepsia, GERD, and other related conditions. If you did like this video, please give me a thumbs up, and if you have any questions at all, do comment in the comment section below. If you're yet subscribed to my channel, please do subscribe and click on the notification bell so you can be notified when I upload a new video. Thank you so much for watching. Bye.